With COVID-19 taking the world by storm in a similar fashion to the 1918 Spanish flu, to an extent that daily life things such as getting toilet paper has become virtually impossible, to us not being able to go to the movie theaters or to even get a haircut has come pretty much impossible for a good amount of the time. It is easy to say that the world has not been the same since, and we've all been through so much in such a short amount of time. With the vaccine mandate slowly coming in and being forced upon federal workers and healthcare workers, there's been a lot of media attention to healthcare workers. But in a COVID unit, none of that really matters, as what does matter for the next 12 hours is the best possible patient care. Some patients who struggle to breathe, some who have fevers and are pretty much just suffering, depend on you to deliver honestly some of the best care possible and to ensure that they're going to basically survive for the next 12 hours. Part of that is actually getting to know your patient and knowing what's important, whether it be their vitals, whether it be sanitizing, don and doffing the appropriate PPE to protect not only yourself but the patient that's with you and your coworkers. My name is Dante Golnick, and I am a nursing technician, and I'm going to guide you to what a shift report is like on a COVID unit. I'm basically telling you about the facts of doing an appropriate passing of information to oncoming staff, using appropriate PPE, and introducing yourself to the patient to let them know that they are in safe hands. Hi, John. It's really good to see you. Thank you for coming to relieve me. So let's go ahead and talk about the patient here. So at this point, it is very important before going into a patient's room that you sanitize, that you put on appropriate goggles, an N95 mask, or even a face shield. It's really up to you. And also what's important is wearing a gown. So before going into the room to do that, you would discuss any vitals, any changes in the patient's status. So for our patient Rick Sanchez, his blood pressure was 107/91, which is not too bad, but not too great either. It's somewhat sort of in the middle. His respirations are at 23. He's suffering from tachypnea, which is very common with COVID-19 patients who struggle to breathe. His O2 levels are 89 at 2 liters of oxygen. It's been a rough night. Very important to keep an eye on the patient as he's been struggling to breathe. Temperature is 99.3, which is down from yesterday's 102. Has been suffering from a fever, and he's been very dehydrated and connected to liquids. So be sure you monitor the liquids and make sure you let the nurse know if a bag needs to be changed out. He is alert and oriented ×3. Now, it may sound crazy ×3. Now, alert and oriented is a scale of 1 to 4, where 1 is basically just gone, and then 4 is perfectly sane. So 3, he's suffering from delirium. He has some trouble remembering where he is. He is not exactly in the right state of mind just due to the dehydration and the fever. So the patient is not a DNR. So if he were to code, you will need to help resuscitate him. That may include doing CPR, assisting with any emergency treatment. Just be aware of that. So after receiving the information possible to deliver the best care, we would then put on our safety equipment. So we would sanitize our hands. We would make sure we have our face shield on, which currently I don't have one. It is at my locker at work. Then we would put on a gown. Always have 2 people to put on a gown because you need someone to ensure that it is fastened properly and that nothing can get through. Then you would put gloves over the gown so that way nothing can get underneath the gloves. Then you would go in. You would introduce your patient to oncoming staff. So, hi Rick, how are you doing? So we are here today. I'm going to introduce my coworker. His name is John. He is a wonderful man. He's been doing this for like 80 years. I mean, 8 years. He's fantastic, very experienced. I think you're in great hands. So shortly, he's going to be here to take your vitals. If you have any complaints, if you're in any pain, if you're thirsty, or if you need anything, you just let us know and we'll get that taken care of. It is definitely safe to say that we are all sick and tired of this pandemic. I'm sure we all want to go back to just living somewhat normal lives if we can get back to that anytime soon. But I just hope that by watching this speech, you kind of get somewhat of a small introduction to what it's like to be in the culture of working on a COVID unit. I do think that nothing compares to working alongside coworkers who help you through COVID shifts. It can be very rough and very taxing on your personal life, personal feelings. It's very common. A lot of coworkers have mental breakdowns, so it's very nice to have them support you. And it's also really important to make sure that your patient knows that they are in the best hands possible. So always try to upsell your coworker to them in the most positive, realistic light possible. But when doing that, definitely be sure that you use PPE, that you provide the necessary information such as vitals, any patient statuses, or any labs that are going to be taken, anything that could be happening within the next 12 hours and the previous 12 hours, and then sanitizing, going into the room with appropriate PPE, introducing yourself to the patient, as it is very important they know you. So, once again, my name is Dante, and this is what a COVID shift report is.